I'm Abhay Gupta. I'm a board-certified plastic surgeon. I'm medical director of Gupta Plastic Surgery. And this is another feature of our question of the month on our website, www.guptaplasticsurgery.com, which allows patients and potential patients to log on, learn a whole bunch of information about plastic surgery techniques and principles, and see a lot of before and after pictures. And as well, at the same time, submit questions about anything you might be wondering about in certain myths of plastic surgery, some new technologies in plastic surgery, anything you were wondering about. And every month we go and pick one of the more popular questions and answer it here, and hopefully improve your knowledge about plastic surgery. So this month's question is about the gummy bear implant. A lot of our visitors want to know, what is the gummy bear implant? How can I get one? Where do I get one? What's it used to treat? So very good question. So the gummy bear implant is the newer implant that's been approved by the FDA for breast reconstruction and cosmetic breast surgery. And it is basically a type of silicone gel implant that has a certain consistency and texture of the silicone that's similar to a gummy bear. So if you cut a gummy bear in half, that firm jelly kind of consistency is the similar consistency to this new silicone gel breast implant, hence the gummy bear moniker that it's obtained. So in order to explain what the differences are between a gummy bear implant and a regular implant, let's talk about what types of silicone implants there are. And there's basically three types of silicone implants. The very first implant, the one that's been around the longest time, is the smooth round silicone gel implant. So called because it's a round shape and it has a very smooth surface for the shell. It's filled with a nice silicone gel, which is very soft, very natural looking and feeling, and then this thin shell that allows it to stay soft and sit naturally within a breast. This is a very, very popular implant used in a lot of cosmetic breast procedures as well as breast cancer reconstructions. And certainly been the one that's been around the longest. Now, there's been very numerous variations of this implant and improvements in the technology ever since they were first designed in 1962. So certainly over the last 50 years, they've come a long way and now are much safer and, again, FDA approved. So the one feature of this implant that makes it much softer is that smooth shell, but unfortunately over time, the body forms scar tissue around the implant. So typically a silicone gel implant we'd expect to last about 15, maybe 20 years in the body. Eventually would have to be replaced because the body will form scar tissue around it, similar to a body forming scar tissue around a knee replacement or a joint, other type of joint replacement, for example. And what happens is the scar tissue squeezes the implant and causes it to get hard and painful. And that's where we go surgically remove the scar tissue, replace the implant. To battle that scar tissue problem, the implant company designed something called texturing to the surface of the implant. So the next type of silicone gel implant is the textured silicone gel implant. This is again a round implant, but the surface of the implant, you can see, has this rough surface. Now it's still very soft, but what the rough surface looks like microscopically is a whole bunch of nooks and crannies. So if the scar tissue were to form over this implant, it's not a straight line like it would be with a smooth implant. It's a much longer in and out, in and out, in and out type of scar. So the importance of that is when this scar tightens, it's a very short distance that it has to tighten to squeeze an implant. Whereas where this scar tightens, it's much longer, so it requires much more tightening before it starts pushing on the implant. Therefore, these implants do not have the same amount of scar contracture, or capsular contracture as it's called, as these smooth round implants do. So that's why these implants are certainly very popular in breast reconstruction and cosmetic breast surgery when we worry about the risk of capsular contracture or scar tissue contracture around the implant. Now again, it's a round implant, as this is. So it tends to give a more full round shape on the top of the breast and the cleavage, which is often a very desirable look for certain patients. Now, for the patients who do not like that round look, this is where the gummy bear implant comes in. And it's, as you can see, similar texturing. Okay, so they kept that texturing to minimize the scar tissue formation, but they've changed that round implant shape to more of a teardrop shape. And if you look at it from the side, more of the implant volume is down below. It looks like much more of a natural breast, much less rounding up top and the cleavage, so you're not going to get a more artificial look on the upper part of the breast or the inside middle part of the breast. So the main advantage of this is a much more natural result when we're doing for breast augmentation or breast cancer reconstruction. Again, the gummy bear, because of the consistency of the gel inside, it has to be a firmer implant because you want the shape of the gel to stay the same in whatever position it's in. So that's why the gel is firmer than a typical round implant where the gel kind of moves around more freely within the shell. One of the main disadvantages of the gummy bear or shaped implant is possible rotation. And so when we put the breast implant in the breast, we want to put it in exactly like so it sits and has the natural shape. What can happen over time is if the pocket is too big for the implant, or if there's a little fluid around the implant that allows the implant to move, then it can potentially rotate in the breast, and suddenly that nice teardrop shape implant no longer looks like a very natural looking breast. So to minimize that, the implant companies have put this texturing surface on the implant such that the body will actually grow tissue into the shell of the implant and hold it in place. And therefore it doesn't rotate, doesn't move, and it keeps that natural look. There's also several bumps on the back of the implant which will help the body lock it in position. But still, that is one of the potential downfalls of the gummy bear implant. Other names for it are shaped implant or anatomic implant or form stable implant, depending on the different companies that produce it. There are 3 different companies that make this implant. So it's a very, very good tool in reconstruction or cosmetic procedures as well, but there are definitely pros and cons of it, and something that we discuss with every patient before we choose implant type. So hopefully that answers questions about the gummy bear implant and silicone gel implants in general. I look forward to reviewing all the questions that are submitted again on the website and pick the next one for next month's question of the month.